So, Stu, one of the big questions that I had for you when we did the podcast, and a little bit of a technical error on my part, was about your assessment process, because I just think that's so unique. And I think it's very valuable for people to kind of get your expertise in that area and what you look at when you take somebody through the assessment process. So, would you kind of walk us through that just a little bit?
Certainly, Mike. I must admit that can take me a long time. As you know, with the sometimes difficult cases I get, I have to
Sure.
be very, very thorough. So this might be well beyond the what is required for the average person. But let me give
Sure.
you three examples. So when I start an assessment, I begin with an interview of the client or patient or athlete or whoever it is, so I understand very precisely what their goals are at the end of all of this. Is it just they want to get out of pain, or they want to return and play golf or lift weights or whatever it is? And then I ask them to describe what causes pain, what takes it away, what time they get up in the morning, the character of the pain throughout the day, the nature of their job. And what I'm doing there is pattern recognition,
Sure.
putting together patterns based on things that we all understand: motions, postures, and loads.
Yep.
So let me give you three different examples. And I'm going to use models. And just to describe these, people ask me where I get these. These are all very highly biofidelic models based on our investigations of the mechanisms, and they're produced by dynamicdiscdesigns.com. I have nothing to do with the company, but they're just so outstanding in showing exactly what happens. So let's take a compressive kind of injury. So I have a sacrum with L5 and half of L4. Now, overloading in compression, the first injury that occurs is the end plate, or the top and bottom of the vertebra, actually get a microfracture.
Okay.
So if I can hold this up and you can tell me if you can see it, I'm going to
Yep.
mimic squeezing, and you see the gel nucleus coming through the end plate. So
Yep.
that's a small end plate fracture. Notice that the disc loses its ability to bear load, but it's really triggered by this compressive mechanism. So if we suspect from that person's history that it was a compressive mechanism, we would simply take the person, say, relax your belly, no bracing, just relax, go up on the toes, and boom, land on your heels. Now that's 1.5 times body weight. The
Okay.
person might say, well, yes, that triggers a little bit of numbness in the hamstring, or it triggers my back pain or my right toe, whatever it happens to be. And then I might say, good. Immediately, can we change how the muscles are organized? Let's change the stiffness. I'll push my fingers into the lateral obliques, lateral to the navel, and I'll instruct, push my fingers out. So it's certainly not drawing in,
Yep.
just stiffen. But I don't say stiffen as if you're going to be whacked in the belly too. That's far too much.
Sure.
And just stiffen and then repeat. Now the person will say one of two things. Oh, that made me more resilient. Or they might say, that made my pain sensitivity even more. And that shows us that yes, it's a compressive mechanism. The increase in compression due to stiffening and stabilizing actually overdrove the injury that I just said. So if it's joint instability, the bracing decreases the micro movements and the pain triggering. But if it's truly compression and this kind of thing, that gives us a clue to keep following it up. And we'll follow that up with several more tests
Okay.
to really strengthen that particular thought or suspicion that that's what that particular pain mechanism is.
Okay.
The next pain mechanism that's quite common, particularly among the clientele today, because we all sit too much. It's a bending mechanism. So if I can show you, there's a two vertebra with an intervening disc, and you can see the gel of the disc and the dynamic nerve roots that move up and down. What I'm going to do is bend this forward to mimic spine flexion and squeeze. watch that little red imperfection in the back of the disc. Do you see the gel bulging out?
Yeah. Yeah.
So that is very typical. Now, if I directed what we call the thrust line right down through the middle and squeeze, the whole disc bulges, but the focal disc bulge on the nerve root does not bulge. Okay. So it's all a matter of hydraulic behavior based on the curvature of the spine. So that's caused, obviously, by repeatedly flexing the spine under compressive load, and the collagen will eventually delaminate. So how we might provoke that kind of a mechanism is have the person sit on a stool, stack their spine nice and tall, grab the seat pan, and pull up. And they might say, no symptoms whatsoever. And then we will say, slouch and drop your chest. So now we've created a change in hydraulic pressure, pull up. Oh, yeah, that there's my pain. Yep. So right away, that's a posture-driven pain. And then we might add some neural tension. Yes, that increases my pain. That takes it away. Or if that takes the pain away, we then have a mechanism that we suspect of a neural underhook. In other words, the bulge is underneath the nerve root. So when they look up, that causes the whole spinal cord to drift down, and you can see how that pushes the nerve root down into the disc bulge. So if you have an understanding of the mechanism and being cognizant of what you're doing as you play with different motions, postures, and loads, it really directs you as to how you're manipulating the stresses and the specific pain trigger. The third one you will find really interesting because of, again, I started this out talking about pattern recognition and how patterns change. And there's all sorts of forces that cause patterns to change. And one of the most interesting forces is the internet and how that changes pain patterns. So, you know, you and I have known each other for a number of years now, excuse me, yeah. And I recall conversations where we would talk about squatting and that kind of thing, and how some of our colleagues would say, oh, you know, squat's too hard on the back. People would be better served or better protected by one-legged squats. So, you know, trainers will then get a little bit rammy or rambunctious about that, and they'll increase the training volume. Well, here's what we're seeing more and more now, and they are true lax sacroiliac joints, but that is what we call the pelvic ring. Yeah. And when a person does a squat, obviously there's no bending stresses in the pelvic ring, but when you do a lunge, and if I was to do something like a Bulgarian split squat, so when I go down, you can see how one half of my pelvis mutates anteriorly and the other mutates posteriorly. And what happens if I can mimic that? Just observe the two angry spots on the sacroiliac joints. Do you see the micro movements that are occurring there? Yep. And that's what happens with too many split squats with too high a load. So, you know, I'm not saying any of these exercises are bad. What I am saying is the programming of them are sometimes quite inappropriate for a particular person. It's amazing. I had a very high-level squash player here a couple of weeks ago. We suspected this, and we said, well, what causes your pain? Well, when we do this, it causes my pain. And then I held the pelvis to absorb that counter mutation, got them to do the split squat, and then we started with very gentle loads just on an exam table. And it took their pain away immediately, showing that it was the, the torsional loads from the asymmetric lunge that was triggering the pain. So anyway, in summary, those are just three little examples of many that exist. And doing systematic provocation testing like that really reveals the combinations of motions, postures, and loads, plus their magnitudes that are the pain triggers. So we don't have to get into arguments, oh, is it the right facet joint? Or trainers, we don't care really.
Right.
All our job is to spare the thing that is sensitive so it desensitizes.
Absolutely.
And then go on and build the pain-free foundation.
I love it. Hey, Stu, thanks so much for your time. I appreciate you coming back on here and recording this with me.
Fantastic. Thanks so much to you, Mike.
My pleasure.